we have to look at the ownership of medication management at all aspects. And as we know, there are a lot of gaps, and we really need to think out of the box how to closely look. Core measure, we are doing pretty good job, but just you can look at your handout that I'm running out of time already. Brian told me there's a notice, so I have to run fast. Some areas, we have rooms for improvement. That's the national top 10% performers, us versus them. You would see some rooms for improvement, and again, pharmacy can make a difference. Then the patient survey, which is the CMS survey, 23% of patients, our patients stated that they did not get any medication-related education. So another area, clinical services and patient care, there are really tremendous opportunities for us to make a huge impact for the patients we serve. We have to again look at the gaps. We need to reduce the adverse events, reduce length of stay, improve patient access, and again, working together, our inpatient, outpatient, pharmacy staff, we can really make a difference. Establish more pharmacy managed protocols. We must have those protocols in place because that's the standard of practice in many academic medical centers, so there are tremendous opportunities there. Reduce waste. Look around everywhere you work. You know that there are many, many opportunities, so we are depending on your feedback. Promote practice of evidence-based medicine. This is one area we have neglected for a long time. This is one area pharmacists can make a huge difference. Ask questions. You are the drug therapy expert. Your knowledge is much superior than many other providers in any organization you go to. So please look at the literature, promote evidence-based practice of medicine, and most importantly, think out of the box. New technology, what does that mean to us? This is a slide from a presentation I made to our risk management group today because they wanted to know why we want to have this expensive unit at place. As you know, the oncology area, there are tremendous rooms for improvement. On national average, about 7 to 9% of medication error. As you know, many of those errors may be catastrophic because of the manual process we have in oncology practice that's throughout the country. So this particular technology has all these safety features. It weighs the drug, it takes the pictures of the chemo drug, then it checks against the barcode. So there are all these safety features combined. It really makes it a very safe practice. In addition, it's really good for our staff because they are not exposed to any chemo compounding. So these are some of the out-of-the-box thinking, and we are looking at many other opportunities like this to improve our efficiency and services, which would make us much stronger, much more efficient. So where we are headed, of course, improve the quality of care. And strategic goals, you already decided in your handout. I would like to conclude my presentation tonight by just bringing this analogy. This is the famous speech by our President Reagan, ex-President Reagan, to President Gorbachev on June 12, 1987. This is the famous Berlin Wall. You know what happened after that. So we have a lot of challenges in our healthcare. We have tremendous silos. We have tremendous gaps. And as a result, we have produced a system which is extremely expensive, and on the other hand, it does not produce a good patient care outcome. All of you know many stories. I have seen thousands of cases like that in my career. Many of you would share the same experience. That's where you come in. Many years, and it still exists, we have survived in healthcare by blaming each other. It's not our problem, it's the nursing, it's the pharmacy, but ultimately, who is paying the price? Ask yourself. That's really that patient. And that patient, maybe you sometime, or maybe your parents, or someone you love. Always keep that in mind. And of course, it's like a juggling act, and there are a lot of gaps there. And the medication management part, really that's where we come in. If we do things right, if we coordinate, if we can integrate our services, of course we can make a huge difference. What does that mean to the patient? They would be healthy. We would see less readmissions. We would see less adverse events. And there is a tremendous benefit out of this integration and ownership by pharmacists. So that concludes my presentation. And again, I would like to thank each of you for your hard work, dedication, and strive for excellence. You have done a lot. Please spend some time reviewing the annual report. And we have miles to go. And we cannot be there unless we work as a team, we work as a cohesive force, we get your feedback, and most importantly, you must take the ownership. Otherwise, these changes would never happen. And I'm excited that we have a fantastic group, fantastic crew. We can make a huge difference. No doubt, we can be one of the top 10 performers, pharmaceutical provider in the country among the teaching academic medical centers. But it's only possible if you do your part, we do our part, all of us do our part. Otherwise, it's not going to happen. Thank you.